Hi, how are you?
All right.
Us here. Good afternoon, everybody. My name is Dr. Jewel Yoder. I serve as the co-director for Goshen College in the Goshen College EMU DNP Consortium. And on behalf of Dr. Melody Cash, who is my co-director of the DNP programs for Eastern Mennonite University, and the entire DNP faculty, we welcome you all to Amy Stier's defense of her Doctorate of Nursing Practice project proposal. Thank you for joining us today for Amy's defense of her DNP project proposal. Sorry, that's a mouthful. And before I introduce Dr. Susan Miller-Satyawan, who has been serving as Amy's lead faculty for this project, I wanted to make some announcements and reminders to everyone joining today. As you can tell, the session is being recorded, and we ask that all guests keep yourself muted during Amy's presentation. We will invite you to keep your videos on. That way it gives her a sense that she is actually presenting to a community of people. If you would want to see the speaker view, you can see that by going to the top of your Zoom bar. And on the far right-hand side of that, you can see an option for gallery or speaker view. And if you choose the speaker view, that will allow you to see her slides and Amy as she presents. Today's schedule is that Amy will have 30 minutes to do her presentation for us. Amy, we will give you a warning at about 5 minutes till the end, and then again at 1 minute till the end. And I may just unfortunately sort of have to interrupt you. We've tried bells, I've tried putting things in the chat, but I may just pop in and interrupt and say 5 minutes and then 1 minute, and that'll just clue you in as to where you're at time-wise. After Amy is done with her presentation, we will turn this over to our audience members for you all to ask questions of her, to engage with her. Feel free at that point to just unmute yourself and really engage with Amy on the great project that she has put together for us. Once we're through that Q&A session, that can take up to about 30 minutes, but I will wrap us up if it feels like we've gotten good conversation and it seems to be coming to its natural conclusion. And at that point, I will ask everybody to exit the Zoom except for Dr. Cash, Dr. Miller-Satyawan, myself, and Amy. We will stay on and have further conversation with her at that point. So this is the point in the presentation where I will turn this over to Dr. Satyawan and let her introduce Amy, her team members, and her project to us.
Thank you, Dr. Yoder. It's a pleasure to be here today and welcome everyone as well. I want to introduce to you Amy Stier. Amy is a board-certified family nurse practitioner and a certified wound specialist. She's worked in wound care for 14 years and brings expertise in that area. She is transitioning to a new position in January where she will be providing coverage at outpatient wound clinics and post-acute settings in the tri-state area of Michigan, Indiana, and Ohio. So we are pleased to be here today for her project proposal defense. Amy's team has included myself as well as her peer and fellow student, Hannah Ferguson, who is an educator at EMU and also a board certified family nurse practitioner, and Dr. Jewel Yoder as well, who has served as her faculty member. So, Amy, we're pleased to have you here and welcome you to begin your presentation.
Thank you, Susan. All right, welcome everyone to my wound prevention and wound care education DNP oral defense. My name is Amy Stier. As Susan and Jewel had welcomed everyone, I am a family nurse practitioner and a certified wound specialist. The phenomenon of interest evolved from clinical experiences observed through clinical expertise and with the desire to make a meaningful impact relevant to nursing practice and patient outcomes. Nurses were witnessed to have enthusiasm to learn about wound prevention and wound care fundamentals, but the education was being presented in fragmented, situational instances at the patient's bedside or during lunch and learn segments. Learning was also being achieved in empiric ways. Nurses were providing wound prevention and wound care that was not grounded in evidence at the detriment to patient outcomes. Thus, the phenomenon of interest was developed: wound prevention and wound care education. The problem: the cost of wounds is multifactorial, with expenses experienced at the patient, nurse, healthcare system, and global levels. The consequences of non-healing wounds can impact patients physically, psychologically, and economically. Physically, wounds can be painful. They can cause heavy exudate, impair mobility, and can produce embarrassing malodor. Wounds can also be associated with a reduction in quality of life, social isolation, stress, and stigma. The economic consequences can stem from treatment costs, income loss due to time off work, and costs endured by caregivers in providing transportation, care, and time away from work. How do social determinants of health factor into the patient impact? Does the patient have access to home health care to assist with their wound care needs in their rural community? Does the patient live in a shelter, a vehicle, a camper, an apartment, or a home? Does the patient even have secure housing? What type of bed is the patient sleeping in, or are they couch surfing? Does the patient have a support system? Will the patient be able to afford the public transportation fare to attend appointments? Is time off from work a realistic option to help heal the wound? What is the patient's literacy level? All of these elements further contribute to the burden of wounded patient experiences. This graph depicts the 5-year mortality cost for patients with diabetic foot ulcers, or DFUs, as represented by the red bar. Those suffering from minor and major amputations, critical limb threatening ischemia, or CLTI, depicted by the magenta bar, versus cancers and Charcot deformity. So the price of a wound can ultimately be equated to the loss of a person's life. What are the costs incurred by nurses? There is a cost to learning empirically rather than being equipped with evidence-based knowledge and skill sets. Nurses bear the burden of moral injury when variability in care occurs due to a lack of clinical competence. Wound care is also a labor and time-intensive and an error of patient ratios, staffing concerns, and time constraints. How do wounds impact the healthcare system? As of 2022 data, 8.2 million Medicare beneficiaries were affected by wounds in the US. Please keep in mind, this figure does not reflect the number of patients affected by wounds that were covered by other health insurance plans. The financial burden is estimated to be $97 billion annually in Medicare spending alone for all wounds. When just looking at wounds related to diabetes, diabetic limb complications are more costly than the 5 most fatal cancers in the US. While 85% of all non-traumatic lower extremity amputations are preceded by a non-healing wound. These numbers demonstrate the monumental impact wounds have on the population. Globally, wounds are manifesting into a silent epidemic with high burdens to patients, healthcare systems, and global economies. Wounds are a major concern, affecting millions worldwide and costing billions of dollars. Factors like an aging population, rising rates of diabetes and obesity, and insufficient research funding exacerbate this global silent epidemic. How do these statistics factor into a DNP project? What can the profession of nursing actively do to face the challenges of caring for wounded patients? And what upstream proactive solutions could be implemented? A literature review revealed the basic competencies in wound care combine knowledge, skills, prevention, performance and etiology and care, along with wound management and assessment. The review further acknowledged the lack of wound care being adequately addressed in undergraduate nursing education curriculums. These shortcomings in wound care education are leading to limited competence, and continuing on-the-job education is failing to prepare nurses for clinical practice. The literature deemed education in wound care relatively poor overall, with many skills achieved in empirical ways. What is one of the reasons for these gaps in undergraduate nursing curriculum? Less than 10 hours of undergraduate nursing curriculum is devoted to skin integrity and the care of wounds. No defined guidelines for wound care curriculum exist. This statistic is not inclusive to the nursing profession alone. This is a consistent finding with medical school curriculum as well. Less than 10 hours of skin integrity and wound care education does not allow for the basic principles of wound care to be addressed. Undergraduate students require evidence-based wound care education to prepare them for clinical practice. Wounds are present in every population of nursing experience, from neonates to end-of-life populations. Nurses also experience wounds in every segment of practice, including behavioral health settings, to emergency departments, to outpatient and inpatient units, and post-acute environments. As clinical practice becomes more specialized and rooted in evidence with clinical practice guidelines to drive care, curriculum development is necessary to equip undergraduate students with basic wound knowledge and skill sets to confidently transition into clinical practice. Students benefit from improved career satisfaction, discovered career development opportunities, feel less overwhelmed in their role with improved competence, and gain insight into a nursing role or specialty through education. The purpose of the DNP project aligns with Goshen College's 5 core values: passionate learning, Christ-centeredness, compassionate peacemaker, servant leadership, and global citizenship. The project fosters a joy in learning that promotes growth and purpose. In Matthew 25:40, Jesus said, "The king will reply, 'Truly I tell you, whatever you did for one of the least of these brothers and sisters of mine, you did for me.'" The DNP project addresses issues involving marginalized and vulnerable populations by serving others and developing leaders who are committed to service in a diverse and interconnected world. After evaluating the impact of wounds on patients, nurses, healthcare systems, and globally, reviewing literature and reflecting on gaps in clinical practice, a proactive resolution was developed. A solution embedded in the foundation of nursing clinical practice to prepare undergraduate nursing students with evidence-based knowledge in wound prevention and wound care was launched. A needs assessment was conducted with Goshen College faculty and undergraduate nursing students to establish what, if any, needs were present. Faculty and students completed a wound care education survey comprised of 12 Likert scale questions and 1 open-ended question to evaluate wound knowledge and competency skills. The results were wound healing, wound cleansing, wound assessment and measurements, prevention strategies, etiologies, negative pressure wound therapy, or more commonly known as wound vacs, pressure injury staging, and wound dressing selection as areas in need of support. An interview with a wound ostomy and continence nurse specialist, Amy Robinson, echoed the above findings, in addition to including identification of signs and symptoms of infection and pressure reduction as key areas to focus on in educational development. Patricia Benner's conceptual model will serve as a map to guide the structure, process, and outcome of the DNP project. Benner's novice to expert framework complements the project purpose well. The novice learner is taught rules to govern actions. Benner emphasizes that clinical judgment and proficiency are developed over time through practical experience and education. These concepts will be the underpinning when developing the intervention. The intervention portion of the DNP project will include evidence-based learning modules. The literature review and needs assessment findings informed the learning module themes. 10 independent content areas will be available for undergraduate students to view. The modules will stand alone to allow learners to view the content in any order dependent upon the learning goals. Content will not build from one module to the next to allow for the individual module to coincide with the curriculum and needs of the learner. Each module will be 15 to 30 minutes in length and based upon evidence, consensus statements, and clinical expertise. Each module will have learning objectives to support the content presented. Prior to implementation of the learning modules, learners will take a baseline wound prevention and wound care test to evaluate the learner's knowledge and competency prior to the intervention or beginning of the learning modules. The learners will take a pre and a post test with each individual learning module to evaluate the response to the content presented. Test questions will be based upon the learning objectives and material presented in each of the learning modules. At the conclusion of the intervention period, a cumulative post-test will be conducted to determine the learner's level of wound knowledge and competency with the intent to mirror the initial pre-intervention test for the sake of comparison. How will the pre and post-test data be collected, analyzed, and interpreted? Google Drive will be employed to develop testing for the ease of distribution and collection of results. The findings will then be converted to a Microsoft Excel spreadsheet and Microsoft Word for graphs and charts. Central tendencies for mean, median, and mode, and the variations for range and standard deviation will be measured. The descriptive analysis will provide an overview of the independent, confounding, and dependent variables. The interpretation of findings will determine if the intervention or learning modules were effective, areas in need of improvement, and opportunities for growth. Continued support from Goshen College faculty is a key factor in the sustainability of this project. Faculty expertise and guidance will be a strong asset. Broadening educational topics is another way this project will grow and endure. Ostomy education was identified as another area in need of additional educational support during the needs assessment phase of the project. Expanding advanced educational content to graduate students is another method for sustainability. Advanced wound subject matter could include education on hyperbaric oxygen therapy, basics of wound debridement and biopsies, cellular and tissue-based products, advanced assessment skills, compression therapy, and diagnostics as a few examples. If the DNP project is deemed to be statistically significant in producing desired results and beneficial in preparing undergraduate students for clinical practice, pursuing an intellectual property trademark may be a beneficial professional opportunity. Dependent upon the value of the change initiative, the learning modules could be introduced to other institutes of higher learning and possibly healthcare organizations to support lifelong learning opportunities for staff. What are the value and implications for practice? The goal would be undergraduate nurses entering clinical practice equipped with wound care knowledge and confidence to provide competent wound prevention and wound care. Patients, in turn, would receive evidence-based care that would substantially and subsequently lead to improved outcomes. Patients and the healthcare system would reap the benefits of cost reductions with competent, wound knowledgeable nursing care. What are the implications for the profession? Nurses are perfectly positioned to excel in wound care. There is a phrase often recited in the wound care community: we care for the whole patient, not just the hole in the patient. Nurses deliver a unique flavor to healthcare, and that flavor is the ability to view and care for the patient from a holistic perspective. Nurses are the advocate, the nurturer, the listener, the teacher, the deliverer of care, the compassionate professional, the lifelong learner, the researcher, the leader, the givers of hope and hugs, and sometimes the patient's loudest and only cheerleader. By God's infinite wisdom and creation, we are all designed to heal. Many of our patients will heal during their time here on earth, while others become whole once they enter the Father's presence in heaven. Prepared with wound knowledge and competence, nurses are perfectly positioned to help with that healing trajectory.
All right, thank you.
You're welcome. I'm happy to open the floor to questions and discussion.
All right, hit the wrong button.
I'll start. You did a great job, Amy. It's exciting to see
Thank
how
you.
this is coming together for you.
Thank
And
you.
this is an area that I have no clinical expertise in, so I love those opportunities to learn from students. I wonder what part of your plan or how you see this fitting into the curriculum, like with the implementation phase of this project. Do you know yet how it's going to be rolled out to students or in what context or how that will work?
Don't have those details exactly and precisely worked
Hmm.
out at this point. That's why I was thinking that it would be best to have each individual module stand alone so that it can fit anywhere in the curriculum when it's the appropriate time. That way it can meet people's needs as they arise.
And I think that's totally appropriate. I was just curious kind of what your thoughts or plans were. So to be determined in the next semester of
Yes, to
work.
do
Yeah,
yes.
perfect.
Go ahead, Don.
Yeah, Beth took the question from me. So, Amy, great presentation. I was just reflecting on the conversations you and I had about 10
Mhm.
months ago or so about your the challenges with your employer, and it's great to see you at this point and reinforces what we've tried to say is we will find a way forward. We will walk with you through this. I did have a question. Oh, are you going to be you're going to be writing each of these modules and doing
Yes,
videos and stuff with them? Is that right?
yes,
Cool.
yes.
That's exciting. Great.
Yes, you
Good
were a
job.
catalyst in helping me to trudge forward because in the spring semester things were not looking very hopeful. So you connected me with Jewel and it was definitely a blessing.
Yeah. Well, that's why we're paid the big bucks thanks to you all.
I can ask a question. I
Go ahead,
think
Hannah.
one of the things that I've been preparing for with my own project is considering like what are potential facilitators and barriers when I'm implementing this project. Do you have any barriers that you're like thinking about and how you're going to address those with project implementation?
Hmm. just the coordination of when it will be fitting into the curriculum and where. I think that's one of the biggest barriers, but I think just keeping up that communication with Goshen faculty, I think will help immensely. They've all been, so far, everyone's been very supportive of this. So,
Don't need to belabor this. Kathy, any questions that you have or anything? Okay. All right. Well, then thank you everyone for your time here today. We greatly appreciate it. And again, I will let you all go. Susan and Melody and myself and Amy will stay behind, but enjoy the rest of your days. Thank you so much.
yes, thank you all for attending. I appreciate it.
Thanks. Good luck, Amy.
Thank you.
All right. Amy, great job getting through this here and stuff.
Thank you.
Typically at this point, once we've kind of dismissed our audience, we give about a what, 5-10 minute break here. Since we're a little ahead of time, I'm gonna suggest we take a 10-minute break. Let's reconvene about 3:40.
Okay.
It gives you a chance to go catch your breath, celebrate that you're at this point, and we'll
Yes.
reconvene and the three of us will kind of continue with some questions for you. Okay?
Okay, sounds good.
All right. Thanks. I will pause us here at this point, I guess. And Amy, you get this recording, and I have sort of AI taking some notes and stuff for us. So again, don't feel like you just engaging with us is perfect as you've been doing. Um, I'll jump in, and ladies, feel free to join me. I again, you did a nice job with what you presented, but you left 12 minutes on the table, Amy. And so I just feel like those 12 minutes could have been really well used to help do a bit of a deeper dive into. I'm clear that you're using Benner, but I didn't hear you once talk about how this is a program development, program evaluation kind of project. So really the like execution of the project of what the design was, how you were going to kind of get students. And again, I get that some of that is out of your control as far as not knowing quite where this fits into the curriculum. So I know there's some things as far as participants and stuff that you couldn't completely answer with that. But I guess I wish that you would have used a little bit more of that time. I thought it was very powerful when you talked about 10 hours in the curriculum being devoted, and that not being unique to nursing, but also to medical students. But I feel like some of that 12 minutes could have been a bit of a deeper dive into the literature a little bit. As far as like, are there gaps that aren't addressed in the literature? Again, this is such a unique area to be focusing on wound care. Very few people can say that they're experts in wound care. And so when you talk about evidence-based practice or you talk about wound consensus models, talking to your audience about what is that, what organizations drive some of that would have added. You are an expert, and as Susan introduces you with 14 years of experience, yes, that's important. But again, for this to feel like it's doctoral work, to have had references and stuff like that in your slides, kind of showing us, I'm going to build off this consensus model that's backed by this organization. I felt like some of those pieces to me were missing a little bit.
Okay.
Yeah, I was going to ask. Very nice presentation, Amy. Very, very well done. You can tell you're very passionate about this, and you don't have to say, but I feel like there might be a personal component on some level to this, and deeply personal. And I think that when we're passionate about something, that really moves us forward. I was going to ask, could you speak a little bit about more, and I did review through your paper a little bit, but a little bit more like what is informing how you create the modules. Just talk to me a little bit about what you'll be using to create them, what the evidence is, kind of a little bit more about that would be helpful for me.
Okay. Kind of like what Jewel just said, the consensus models that are available, there's some through the International Wound Journal. They're a driving force on a lot of this. The Walk Nurse Society has different consensus models. Oh goodness. So using those consensus models, some of the clinical practice guidelines that are available, one of them would be through the wound certification I completed. I did a review course with them that was very intensive with a lot of the wound care leaders that are in this arena.
So how are you going to take all that and like whittle it down to like these smaller chunks of modules that then students can do? It sounds like kind of a self-paced thing, like like a little bit about your, like what you're thinking about your process of how to take all that. We're not training them to be wound care nurses, like
no.
Right, but like what, how are you going to determine like what's the essential component that a novice nurse would want to know or need to know?
Well, some of that's based off the literature review, what it found, what I found that was lacking in those areas. And based off the survey I did as part of the needs assessment, those areas, and then just breaking it down to those basic foundational tools to help with just simple, straightforward wound care that people are going to encounter in their practice, not in an outpatient wound center or in a more advanced setting.
Yeah, and I remember you did that needs assessment. Yeah, that's right. Can I keep going? Is that okay? Have you talked at all or thought at all about, so that I'm sure you're aware of the new essentials, the AACN, the new essentials that have come out, or maybe not so much, I don't know, because you're coming from practice to this academic sort of setting, but has that come up at all about like mapping any of this to the new essentials and competencies that way? Is that a discussion you all have had, or is that not?
No, we haven't had that discussion as of yet.
I just wondered if that might be helpful to Goshen, adding that in. I don't know. You all can think about that. Yeah, those are my.
Well, I have a couple things I want to ask you too. Amy, nice work. And I just want to say, it is hard to talk for 30 minutes, especially when you've practiced it for so long and you're like, I remember getting through my defense and thinking that was so boring because I'd heard myself say it 5 or 6 times.
It wasn't boring.
It's one of those things where it's just hard to keep going. You feel like you're getting so little feedback, but nice work. And again, like Jewel said, there's some things that could have been added there to kind of give us a little more background and way forward, but you did a nice job. I did have a couple of questions. One, one is I wondered, as you talked about your analysis, if you've thought about any ways that you want to build and how you might adjust your modules or change them based on what you hear back from people. So that's one question. And the second one, well, then I have some more, but the second one there is like how are you thinking about integrating like simulation and active learning into your modules as well?
And that was something else that I definitely want to explore more with the faculty. I've had little communication with I believe it's Randy that works in the simulation lab. If they have anything that you can actually do hands-on simulations as far as wounds are concerned, especially when you talk about negative pressure wound therapy. I know many of the larger health systems have what they call their wound team or a wound care nurse. Well, not everyone's going to have the privilege of working in a large center, in a large hospital setting, and your wound care team's only there Monday through Friday. So who manages that wound vac, as an example, at 3 a.m. when the leak alarm's going off? So some of these skills are just basics that you need to know to be able to treat and care for your patients. So I'll be interested to see if there is that as an option, especially when it comes to a skill set such as a wound vac. You can watch a video on it and you can hear someone lecture on it, but to really put your hands on a patient or a model makes a big difference. To get the feel of working with the materials, that's much more effective. So I'm curious as to how that will work, especially as that as an example.
Yeah, thank you. That answers that one. I also wondered, like, no pressure, but we did notice there were some tears there. Do you want to say anything about where that kind of came from?
I had some really heavy news about 20 minutes before this started. So
Oh, sorry.
that's where that came from. My son has to have open heart surgery, so
Oh,
So
I just
sorry to
talked
hear
with the surgeon. So it was not the best timing to talk
oh,
to
that.
him.
man.
And
Absolutely.
yeah, so that's where that came from. So I
Yeah.
didn't expect that to happen.
Yeah, no, that was a hard one. Thank you.
Yeah.
You
And my
dealt with
last,
it perfectly,
Welcome.
honestly, as somebody that wears their emotions very close to the surface. I thought you handled it very graciously of I am one that gets choked up with things too, and I have not gotten news such as you've gotten and stuff. And so I thought you did a great job of taking a moment to compose yourself. And it honestly spoke to, I think, what Melody was saying of it. It came across, not knowing about your son, it came across more of just a sense of being really passionate about this. So, um, anyhow,
Which
go
I
ahead,
am,
Susan.
but I can't take credit for that part.
That's
but not
fair.
crying passionate. And my last question was, do you feel like you have what you need now to move forward into the implementation stage? Like what pieces do you need yet to kind of know how you want these modules to be developed? Like, have you thought that far ahead?
Yeah, and I started to work a little bit on just developing one module just to start getting a feel for what that's going to look like time wise, how to manage that. Um, the biggest part, I think, is just where in the curriculum this is going to fall. And
Yeah.
again, that's just going to be ongoing communication and collaboration with faculty.
Is your thought that you will go ahead and create these modules and then be like, okay, where do you as a faculty want to put them in? Or are you looking for closer a working relationship with faculty to be like, okay, for this class, I'm going to present this or prepare this module?
Yes, I was thinking more from the perspective of the faculty having a better insight as to where they would fit rather than I would.
I mean,
And also to be respectful of where I'm coming in. I am a student myself.
yeah, I mean, I guess my question is like, do you feel like you can just create these modules and then be like, here they are, like you decide, or do you want more input from the faculty about how to move forward with what you'll put where?
You know what? I'm not really 100%
Mhm.
sure.
Sure.
I'm
Yeah.
sure as I develop them, I would definitely appreciate guidance because I
Mhm.
don't have any experience from an academic standpoint. I've done many presentations for my job and in the community
Mhm.
on this particular topic, but to present it in an academic setting is something that's new for me.
Mhm. Yeah. Thank you.
You're welcome.
Will say, and this is being recorded, but I will say that I spent my morning being the mother of a 7-year-old patient that was in a motor vehicle accident and had a ORIF of their femur. And so we had a big wound that was festering, and Randy had added smelly stuff to make it smell gross and look gross. And so, again, we did not have a wound vac included in this particular scenario, but I think that your modules play an interesting part in the pre-work that a student can do to be ready to come in to do simulation, which is then tied to what Melody Cash was saying about competency based of tying some of those curricular components to that. So I think just maybe some more discussions with myself and Randy and the faculty on how these modules may be reused at various points throughout the curriculum. But I do think if you're going to develop 10 modules, we should name how we want to use the modules. That's a pretty key part in this feeling like it.
Mhm.
whether that's in yeah, just where do these 10 modules fit within the curriculum, or how would we use them at multiple touch points?
And I don't think you have in there, Amy, but I would welcome a module or a part of a module on wound care and aging people and their special needs. As I teach gerontological nursing, I think that would be kind of a nice way to add that gero focus to the wound care as well too. But that's just adding.
Yes, because there's
a role
definitely
to
unique
play.
needs for that population.
Yeah, and especially if it's something like I like the idea of it being a module a student can kind of do on their own. And that's something that can be assigned then, or the professors can use it in class, but it could also be something like work through this on your own and then we'll talk about it. So,
Mhm. I think it offers more flexibility
yes.
and in bite-sized chunks.
Mhm.
15 to 30 minutes, you can listen to that on a commute. I mean, it's easier to fit into your schedule.
Absolutely.
Let's switch. Well, do we jump into the paper at this point as well a little bit?
Yeah, we can.
I just noticed in reading through your paper, and I probably need to work with Beth a little bit on this, with her being kind of the first time at this, but Goshen College has identified many places in the paper, and we typically ask students to de-identify the site that it's happening. So you can refer to us as like a liberal arts Midwest college, or small liberal arts Midwest college or something, but you'll want to de-identify your practice site. This is really small, and again, this can be in the notes, but I did notice that on page 12, Prisma for Prisma diagram was just spelled a little bit incorrectly, but again, not a big thing. Otherwise, I enjoyed kind of reading through your paper. Again, make sure that there are, good citations in your slides. There was no reference slide for your presentation, which there absolutely should have been, and there should be some more references in your slide. I think that this slide on like wounds by numbers was maybe the only slide that had any sort of reference to it at all. So I think those are some of my things that I had kind of picked out. Susan or Melody, anything else?
I wondered a little bit about your analysis. You talked about descriptive analysis, mean, median, mode, descriptive. And then later on, you talk about if there's statistical significance in your knowledge, but I don't think you're not running any inferential type statistics, right? You're doing descriptive, right? Mean, median, and modes, which you wouldn't get any statistical significance.
That's true.
I would pull out that.
Yeah.
Think
Well,
of it a different way.
And I wonder, Amy, if you want to do a t-test between your before and afters, because
Yeah,
that
you could
will
do
give
that.
you
Yeah,
that. I mean, it's going to be small samples, so you may not have any significance anyway.
yeah,
But those
yeah.
aren't hard
Add
to
that
run
in.
at
Yeah,
all.
yeah. If you would pair if you did a t-test and just looked at that, and then I would suggest adding that in, and then saying, something about with a small sample that, any results you get aren't necessarily going to be significant, but could indicate
Mhm.
that this would be beneficial or something like
Okay.
that. So that kind of a little bit more vague wording. But yeah, I think, because you don't talk about any type of inferential statistics that I can see.
And I've given lots of feedback to Amy, probably more than she really wanted to see.
No, not
I
at
don't have
all.
anything else to say. Poor Amy, I felt really bad sending that off to you. And it made me
I didn't at all.
Yeah, next time I'm going to ask my students to send it to me chapter by chapter, so it doesn't feel like it's all at the end.
Yeah.
I felt kind of bad.
I agree. I think that would have been much more helpful to tackle it one chapter at a time,
Mm-hmm.
Yeah.
rather than trying to
Pull this
work
whole
on
thing
the
together.
entirety of it.
Yeah.
Mhm.
Yeah.
You did a nice
No,
job.
I didn't feel
You're very
overwhelmed at all. I
gracious.
wanted feedback.
Okay, good. You're
I
very
do
gracious.
wonder too on this. You mentioned at one point, I want to kind of measure students' knowledge. I want to measure their their growth and competency, and their kind of increased confidence. Now there are confidence tools too, as we're thinking about surveys. You know, do we do
Sure.
something like that that again would give us some sort of data that we could analyze? And I do think the competency that can tie to some of these simulations that we're talking about. So I think there's going to be lots of fun ways to do this.
Okay.
All right, ladies, are we ready to go convene here?
Yeah, I think so.
Okay. Amy, you sit tight for a second, and the three of us are going to put ourselves in a breakout room, assuming that I do this correctly here. One breakout room. All right, we will be back with you here in a bit then.
All right.
for Jewel to come back. Well, Amy, as your lead faculty, I want to say congratulations. We are excited that you have passed your proposal defense. And
Thank you.
you are now cleared to move forward. First steps, looking at the IRB and making sure you have everything in place for that and get that into Goshen College. There's usually a pretty fast turnaround with that. And
I know you had said that before, but I've had that out to him for probably a couple months now. I believe it was in October, end
you
of
have like,
October, when
you have the full application out to him?
I sent him on the checklist that you had signed and I signed.
I think there's a fair bit more. Let's look into
Okay.
that.
Yes.
I can send you some things, but that's just kind of like a preliminary sort of a
Okay.
thing. There is more to do, and I'm sorry to tell you that IRB can feel a little overwhelming, but there's pretty fast turnaround for that. And you can refer to yourself now if you're writing credentials as DNP-C, which means you are a doctoral of nursing practice candidate.
Oh,
So
nice.
you have an official designation until you finish, you have passed your final project defense. So congratulations.
Thank you so much. I appreciate that.
Yep. Thank you. We see a lot of value in this. Again, it was Don kind of saying, "Whoa, like how can we help this student um, that is tied to our mission and to what our DNP is about?" But again, you are adding value to what we're doing, Amy, and I appreciate that, and I really look forward to seeing how this rolls out and stuff. So yes, do IRB, and then I think one of the next things is probably to get you on campus, maybe a meeting with Susan and I and Randy would be sort of some of the next steps as well as we move forward. As you move into 802, which is my implementation class, you'll be doing pretty frequent team meetings and stuff. That's a big part of it is you're doing the project and you're meeting with us on a pretty regular basis. So, anyhow, I look forward to that.
Thank
Ladies,
you so much.
otherwise, I think you can enjoy the rest of your afternoons. Go take some time for yourself, Amy. It sounds like here with the news that you're kind of grappling with. He's had heart problems for quite some time, correct? Your son?
Yes,
Yeah.
he was born with a heart condition. This will be his fourth open heart surgery.
Oh, wow.
So this
How,
is not new,
and
but it's just
how old is he
he
now?
is 31 now, but
Okay.
he has about the mentality of about a 14-year-old boy. So
Okay.
Okay.
he still relies on me a lot for
Yeah.
support. He has no spouse or significant other. So
Yeah.
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 It's a
we
lot
were
of-
told though in the spring he would have another 2 to 3 years before he needed surgery, and we found out that's not the case. So
Okay. Okay. Well, we'll be including you and your son in our
thank you.
prayers here today. So thank you. And again, great job. Maybe this is a little bit of a ray of sunshine for you.
Yes, yes, it
Yeah.
is.
Yeah.
All right.
All right. Well,
Again,
thank
give
you.
me a day or so. I will compile this recording that you have it. But again, Susan kind of has the notes on how to guide you through what's next and paper and so on.
Yep. Yep.
All
And I
right.
will definitely be in touch soon about the IRB, about your process here.
All right. Sounds
Okay.
good.
Thanks,
Okay.
ladies. Have a good day.
Bye-bye.
Too.